Coming up next, we do have Dwayne Steward, who is the Director of Prevention at Equitas Health. He will be talking until 12:30, explaining a little bit more about Equitas and what they do. And Dwayne, I will give you a 5-minute warning before 12:30, so you know roughly when to start wrapping up.
Alrighty, thank you so much everyone for having me. I'm gonna just share my presentation here real quick. Yes, I hope you all can see that.
Yep.
All right, so thank you so much again for having me. My name is Dwayne Steward. I am the Director of Prevention at Equitas Health, and we are a health system that's really focused on providing care for all to LGBTQ plus communities and allies of those communities, and just really we're really just focused on providing a welcoming healthcare home. I'm just going to basically give a presentation about the organization and how we try to have an impact on the ending the HIV/AIDS epidemic. So first, our mission is to deliver high-quality, patient-centered, accessible, cost-effective, and timely primary health care to all, to provide high-impact prevention, health, and wellness services, and to be the gateway to good health for those who are at risk or affected by HIV/AIDS, along with the LGBTQ community and those seeking, like as I mentioned, a welcoming healthcare home. Just a quick timeline, and I'm going to go through the timeline of the history of Equitas Health because it also kind of parallels with the timeline of the HIV/AIDS epidemic, and I think provides some interesting points of how the response to HIV has played out in the state of Ohio and around the country. So between 1984 and 2010, many of these the places you see listed here: Dayton Area AIDS Task Force, AIDS Foundation Dayton, AIDS Foundation Miami Valley, Columbus AIDS Task Force. A lot of these agencies began to start to respond locally to the HIV/AIDS epidemic in their area. This was from the beginning of kind of the start of the response to HIV/AIDS on up through 2010. And there were several organizations that really stood up and decided to align themselves with the national efforts around the country to respond to how this was looking in the state of Ohio. What was really exciting about this time is, we were in Ohio. It wasn't until like the early 90s that it was the first time that national HIV/AIDS funding, Ryan White funding, really made its way into the state, and that really was what was the catalyst for really launching a lot of the agencies you see listed here today. Fast forward up to 2011, there was a major merger locally of the AIDS Resource Center Ohio, and merging with many of the entities that you see listed in 84 to 2010, and really to create one kind of major conglomerate that was really fighting this effort. Columbus AIDS Task Force and all of the agencies listed kind of came together under one brand to have a much larger impact. We launched 9 offices. 9 offices existed at that time, and around 2,931 clients were being seen at that moment. We had about 75 employees. So this was kind of the first major effort to put everything kind of under one roof. Then 2012, 2013, we added a medical center in the Short North and a pharmacy that was specifically geared towards HIV positive communities and LGBTQ and allies. And we continued to grow. As you can see the numbers there. In 2013, added offices in Akron, and our patient population began to grow. I think what was really exciting is we were able to provide a very, again, welcoming healthcare home, because there were, throughout the epidemic, and even unfortunately still to this day, we're very lucky we have great providers that many of them have been presenting to you all today. But there's still a lot of stigma that exists, and there are people who are HIV positive who do not feel safe coming out to their doctors or going and seeking treatment because of discrimination. And so we try to make sure that no matter what, we provide a patient-centered healthcare home that really is free of the stigmas that you sometimes may see in other healthcare systems. So moving throughout 2014, 2017, we continued to grow, adding more medical centers, adding another one in Dayton, and also adding a Canton office. In 2016, we really started to think about our impact, and that is when we really expanded and rebranded to become Equitas Health. So we were AIDS Resource Center Ohio for a very long time, and then became Equitas Health and expanded our work from yes, focusing on HIV, but still continuing to focus on HIV positive and people living with HIV communities, but also expanding to provide transgender healthcare and healthcare for other marginalized communities, as well as we added the Institute to provide education so that we can help educate other providers on how to be the best and work best with LGBTQ communities. And we also added SafePoint, which was our needle exchange program that really works with injection drug users. And we're seeing today a lot of around, especially in Ohio, because of the rise of the opiate addiction epidemic, that the impact of HIV is shifting, and we're really seeing an increase in the number of people that are seeing HIV transmission due to injection drug use and sharing needles. So we wanted to make sure that we were also having a specific response to that. We were also again able to expand and open another medical center in a King Lincoln district in Columbus. We were able to expand our injection drug user programming into Portsmouth and our Ryan White programming into the southeast area, and as well as Youngstown. And then to bring us up to today, we opened Mosaic in 2018. I'm going to talk about that a little bit more. It's a specific program focusing on transgender youth. And we also merged with Bravo, which is focusing on intimate partner violence and just violence in our community in general to reduce that burden. We moved into a brand new SafePoint location for our needle exchange in 2019 and launched a very intensive health navigation service so that we could offer case management and health navigation work to everyone in our community. And for a lot of the funding for a long time, when it came to case management, was really focused, was only available to people who were living with HIV. And we were able to build a program that launched a new program that focuses on providing case management for everybody. And then building up to 2020 and 2021, we launched a medical center in Cincinnati, launched a teleprep program because of the current pandemic and people not being able to come in to receive healthcare services. We launched Telehealth, and really are just, again, trying to make sure that we continue to modernize the response to HIV and make sure we're meeting the people where they are. So Equitas Health, as I've kind of mentioned in our timeline, we have 19 sites throughout the state, and we are in 11 cities. And we provide medical, pharmacy, behavioral health, dentistry, testing. I mentioned the health navigation. Our HIV health advocacy program, our case management program, is a long-standing part of our organization. And we do offer help with housing assistance, harm reduction, and now survivor support through Bravo work, and also legal services. We partner with Equality Ohio and others to provide legal services to folks who are marginalized and may not be able to afford a lawyer. This is just a quick numbers glance at our agency. We've been very lucky to have grown to where we are today. We see about 13,000 medical patients, 46,000 patient visits. We provide, we are one of the top providers to HIV care in the state, and we're very, very, very proud of that. So just getting specific into some of the services that we offer, as has kind of been mentioned to you all throughout the presentations, we are at a point in the epidemic where we have the tools to end this epidemic. It's just really about getting the tools to the people who need the most. The access to care is really one of the major burdens that is keeping us from ending the HIV epidemic. And so some of the tools that you've heard today are U equals U, undetectable equals untransmittable, the access to PrEP and PEP. A person living with HIV who achieves viral suppression, meaning the virus is undetectable in their system, can live a long and healthy life. And actually, science now tells us they are not able to pass the virus to others once they get to that point. And PrEP and PEP are really great tools. PrEP, pre-exposure prophylaxis, which you can, a pill you can take once a day to prevent HIV, and PEP, pre-exposure prophylaxis. If you have a exposure to HIV, you can take this medication within the 72 hours of exposure to keep transmission from happening. So there's so many amazing tools that we have to treat and prevent HIV today that Equitas Health, we are committed to providing to the community. And there are many health disparities that exist. So due to challenges finding a provider who understands unique healthcare needs, especially marginalized people who are at the intersection of being LGBTQ or being racially diverse, people experience disproportionately high rates of chronic conditions. Science tells us that because of oppression in our community, that actually increases health disparities. And so there are certain types of cancers that are more commonly seen amongst LGBT communities, higher rates of suicide, depression, and high rates of HIV, STIs. And at Equitas Health, we try to make sure that we provide a welcoming healthcare home to continue to address these disparities. We do offer, as I mentioned, a patient-centered model, trying to provide kind of that one-stop shop for all of the different healthcare services that you need. So, which includes primary care, behavioral health, HIV, STI, dental. We also make sure that we have financial counselors on site to help folks with the cost burden of healthcare. So we offer sliding fee scales, and our pharmacy helps sign people up to help get medications subsidized as needed. And one thing to mention about our pharmacy, it is also a social enterprise. So anyone who uses our pharmacy to fill their medications, those proceeds from the medication, whether they're paid for by you out of pocket or by your healthcare provider, those proceeds are able to go back into the agency to build our services and provide care at low cost to the community. So our pharmacy, like I mentioned, is a full service, open to the public, and provides personalized adherence counseling, refill reminder calls, text messages, and our emails to patients. And we also now do free home delivery to patients living in Ohio. So as the pandemic began to take off, telehealth was really something that we wanted to make sure got off the ground. We have a lot of communities. HIV, as you've probably been seeing today, is affecting our most marginalized communities who may not have access even despite a pandemic. So having a pandemic really exacerbated the lack of access. And so we wanted to make sure that our clients were still receiving their medications and we still had access to pharmacy and to their medical care. So telehealth was launched. As a part of that, we started mailing, increasing our home delivery to patients when it came to their medications. So we also consider ourselves a model for gender affirming care, making sure that we provide access, a safe space, which is our Mosaic location, which is a safe space for transgender and gender nonconforming communities to come to a judgment-free zone to receive care and services. We provide, an informed consent model where the patient has control over their healthcare decisions, and it's really care-driven goals, really focusing on centering, again, a part of that patient-centered healthcare home, centering really what the patient really feels like they need. And then I mentioned we also offer client advocacy, health navigation for people living with HIV, housing assistance, and our Bravo program, which is support and advocacy for LGBTQ survivors of any type of violence. HIV STI testing and prevention has just been a long-standing program within Equitas Health since the beginning of the HIV/AIDS epidemic. We still offer free HIV STI testing, risk reduction counseling, education, access to PrEP and PEP, harm reduction. And we have a maintained for 30 years an HIV hotline. If you go to ohiv.org, you can pick a chat on either through virtual chat, or you can call someone on our staff and they will immediately chat with you about any questions you have about HIV, AIDS, or STIs, and how you can receive treatment or get testing. And there's many online resources as well. I mentioned our comprehensive harm reduction, mentioned SafePoint earlier. And I always like to highlight this program because it really shows kind of our current modern response to the epidemic. And we're educating the community about safe drug use, fighting the spread of infectious disease, and providing drug treatment enrollment. We have seen a stark increase in Ohio of overdoses, and we have an overdose response team through SafePoint. We do Narcan education delivery and reduce. We try to, the main focus and kind of the science behind needle exchanges is that it shows through public health science that it reduces HIV rates amongst people who inject drugs and hepatitis C. So we are seeing those decreases because of, in Franklin County, because this program exists. And lastly, I want to mention our mobile outreach vehicle. We just launched this actually this last month in March. And we are really now, as a response to the pandemic, started our MOVE initiative, which is Mobile Outreach Vehicle Initiative, and really focusing on getting our services out to the community. And so we've just outfitted and recently purchased this vehicle, and we're looking to provide more. But we're doing vaccination clinics in the community for COVID vaccines, as well as taking HIV, STI prevention education and services and telehealth services. This is also acting as a telehealth access point, this vehicle to go to the community, meet the community where they're at, and provide services to people who may not feel safe leaving their house, or feel safe being in a medical center, or who just may not have access. This pandemic has really shown how health equity has a major effect on our healthcare systems. If you look at the rates, African Americans are less likely to be vaccinated, but really had high infection rates of COVID throughout the pandemic, and just shows the stark health disparity that exists. And this MOVE initiative is really looking at addressing the lack of access to care. Which brings me to kind of my closing point. We really believe that care for all should equal access for all. I just love this quote by Nelson Mandela, which is, "Poverty is not an accident like slavery and apartheid. It is man-made and can be removed by the actions of human beings." I also believe that health inequity, homophobia, transphobia, these are all not accidents as well. They're man-made and can be removed by our actions. And so I put a call to action out to everyone that please use your actions to help rid these ills from our society. And the way you do that is by getting involved. And it's very important that we all kind of make sure that we're standing up and making sure that people do that there really is access for all when it comes to wellness and healthcare. So this is my contact information. Please feel free to reach out if you have any questions. And thank you so much again for having me today.
Of course. We do have a few minutes left for your slotted time. So if you're okay with this, we can open it up for questions. Or if no one has any questions, I believe our lunch break is after this, so we can just break a little early. But I'll give it a minute or two, see if anyone has any questions for you.
I have a quick question. So how do we bring this idea of poverty driving these health disparities into like the healthcare setting where folks might not be on the same page as us? Like, how do we start having that conversation where maybe they haven't heard that people that experience depression have higher levels of stress, and how that leads to chronic inflammation, things like this, causing different conditions? How do we start having that conversation?
Yeah, that's very very good question, and a very important conversation. I think we always have to look at the social determinants of health when we are talking about healthcare. And there's so much research out there that specifically shows the direct relation between social determinants of health and health outcomes. And so I think there's this whole movement about housing equals healthcare, or housing is healthcare. And if you're homeless and don't have a home, that directly affects how you can receive or cannot receive healthcare or take medications that you may need if you have a chronic condition. So I think going back to the research and the science, I think is what's most important. And so when you're having these conversations, directing folks to that information is very easy to find online. There's so much out there around just how health disparities are impacting public health and healthcare in general. So I would just suggest that we take it back to the science.
That's great. I love telling scientists to actually listen to the science.
I have a question. So I think most of us or all of us know that needle exchange places actually do help reduce HIV because we know it can be spread through used needles. But has Equitas faced any backlash for having such a progressive program? Because I know that they're not everywhere in the United States, and I know that a lot of people have very strong feelings about them, and also about providing naloxone and things like that. So have you guys faced any problems, or how do you deal with being such, in the forefront, basically?
Yeah, thank you for that question. I love talking about our SafePoint program because it has come a long way. It's just 5 years ago, we weren't allowed to have 5 to 10 years ago, we weren't allowed to have needle exchanges in Ohio. It was illegal. And through the advocacy of so many people, the groundwork, the people standing up and talking to legislators, saying that, showing them the science around how needle exchanges actually reduce infection, we saw the law change. And so the first one was needle exchange was started in Cincinnati, and then there was kind of a wave of other needle exchanges that started after that, and we were a part of that wave, and I'm really excited about. SafePoint's been around for about 5 years now, and there was a lot of backlash. I think a lot of people, even still today, feel like needle exchange programs enable injection drug users, or and that's the language that keeps being used. And really, it's the exact opposite. Like I always say, go back to the science. It literally shows that there's a decrease in HIV infection, hepatitis C infection, and so actually you're doing your community a service when you provide these needle exchanges, and that's why I think we need to flip the message, because yes, a lot of people still feel like the needle exchange programs that exist are enabling, and it's just not scientifically true. And so yes, we have had some backlash, but it's been great to see groups like Harm Reduction Ohio and other groups around the country who are having conversations regularly with legislators. And that's how I think you continue to affect change, is continuing to have these conversations and put out these messages of what the actual science shows and what the misconceptions are. And so I think that because there's been a national attention around the opioid epidemic, we've been starting to see some change, and the political will, I think, is changing, which is very exciting to see that we're finally having an impact.
I think so too. Thank you so much.
I have one other question. For folks who are interested in getting that Narcan training, how do we sign up for that?
Yes, it's a very good question. I can put my information in the chat or send it to the organizers and to get that to you all. Our SafePoint team, they do those trainings, run by some very amazing harm reduction heroes, like I like to call them. And we provide that on site at we have a site on the west side where we do this work. And so, yes, we can definitely get you Narcan, or we can provide a training. We can set up a training with students. We've done that before. So yes, please reach out, and we can definitely make that happen.
Sounds like we're going to have an SDES harm reduction Narcan Equitas crossover event.
I love it.
I'd like to ask another question. So when I first came to Ohio State, I had never, I'm not from Columbus, and I didn't know that a place like Equitas Health existed. I didn't know that there were health clinics that existed that serve not specifically people who are LGBTQ, but are very open about being welcoming to them. And we all know that the LGBTQ community and others historically have had a problem with trusting medical professionals. And so, and obviously you guys have done a great job of establishing that trusting relationship. What do you think your organization has done that has successfully created a bond or in like a bridge between the LGBTQ community and healthcare professionals?
Yeah, I mean, I think that it's really, again, providing that the welcoming healthcare space from every point in the healthcare system. So from the moment you talk to someone at the front desk, to seeing the provider, to filling out how to, your insurance information, to talking to the financial counselor, like every moment along the healthcare continuum, or as they call it, has to be inclusive and it has to be welcoming. And I think that's what sometimes we're missing. Sometimes you're in a system where that your doctor is amazing and you love your doctor and they're very inclusive, but the front desk staff just are very homophobic or transphobic and they're saying terrible things as you're waiting in the lobby. Like that really turns somebody off. Like you have, and because of those actions, that keeps someone from getting healthcare. That's actually, science, again, the research shows that if you're not a welcoming healthcare home, you actually decrease someone's access to care and exacerbate health disparities. So I think that's really the message for me is, you the action of not being inclusive is actually harmful to somebody's health. And we make sure we flip that on its head. And we're going to, in Equitas Health, at every moment of your care, we're going to make sure we're using the right pronouns. We're making sure that we're addressing any concerns you have. We're doing it from a motivational interviewing standpoint, where we're trying to figure out what you need and trying to meet your needs, as well as educating you on other healthcare issues that you may be dealing with. So again, I think it's about shifting the focus to the patient and their needs, and not and removing any type of judgment or barrier to their care. I think that what we do well is we make sure that happens at every point in the care continuum.
Yeah, I think you answered that so well. That's exactly how I feel. I've not entered Equitas that many times, but the few times that I have gone, I feel like I experienced exactly that. It's the only place I've ever had providers like talk about pronouns and seeing models of like gender diverse people and people in diverse relationships. I think you hit the nail on the head there. Thank you for that answer.
No problem. Any other questions?
All right, thank you, Dwayne. We really appreciate you coming and talking to us about Equitas.
Thank you for having me.
Yep.